sorry it took so long. I just had to go back and get the tote.
Oh, that tote.
I know, it's so heavy.
Hey, did you get to study for the test on Monday?
Yes, I did actually. I was studying the EdPi, the S-Bar, what else? The 6 rights. But don't forget, we also have to do our presentation for Monday, our medication.
Oh, that presentation.
I know, but you know what? I gotta show you this video. It's really good, and I know it's gonna help us deliver a good presentation.
Really? Let's check it out.
Yeah, here.
Hi, my name is Jeanette. I'm your discharge nurse for today. How are you doing, Mrs. Martinez?
Oh, I'm good, but mija, don't call me Mrs. Martinez. Call me Rosa.
I'm sorry, Rosa. Do you feel any pain?
No, I'm fine right now.
Now, I'm here to talk to you before you get to go home about a new medication Dr. LOL prescribed for you.
Okay.
Now, that medication is called Propranolol. Do you know what Propranolol is used for?
No, mija.
Well, it's used to treat high blood pressure. Do you know what high blood pressure is?
No, not that one either.
Okay, well, I'll explain it to you. High blood pressure is when your heart has to work harder to pump blood throughout your body. Okay? Now, that is one of the reasons why you felt dizzy, you had nosebleeds, you had headaches. It was because you have high blood pressure.
Oh, no wonder.
Now, we're going to get to treat that for you. Now, I want to talk to you about common side effects of this medication.
Okay.
Common side effects include you might feel tired, you might feel dizzy every once in a while, your sex drive might decrease.
Oh, no.
Yeah, and you might not be able to sleep at night. Okay. Now, we do want you to contact your primary care physician if your heart starts to beat in an unusual way. Okay. If you have a hard time breathing, if you notice that your legs are swollen, if you feel that your hands and feet are cold all the time, we do want you to contact your physician about that, okay?
Okay.
Now, I did review your discharge medications, and none of them will interact with propranolol. I want to make sure that you take a current medication list when you visit your primary care physician so that he knows what medications he should prescribe to you that won't interact with propranolol.
Okay.
Okay. Now, I do want to let you know that you should not break or crush this medication. And if you plan to purchase over-the-counter medications or herbal remedies, I'd like for you to contact your physician to make sure that there are no interactions with propranolol, because it may increase or decrease the therapeutic effect of this medication.
Okay.
Now, you should avoid alcohol, you should avoid smoking, and you should also modify your lifestyle so that your blood pressure may come back to normal.
So no party.
No party. This means that you will have to include a modified exercise. You will have to adjust your food so that you'll eat healthier foods, and also control your weight. Okay, this will all help you decrease your blood pressure.
Okay.
Now, we also want to encourage that you don't get stressed out. If you if you miss a dose, we don't want you to double your dose because your heart rate can decrease and it could be dangerous. We want you to hold it. Take the medication if your next medication is due in 8 hours. And also, I want you to check your pulse and your blood pressure before and after you take this medication. If your pulse is less than 50 beats per minute, I want you to hold the medication. And if when you check your blood pressure, if the top number is lower than 90, you should also hold your medication. Now, I will show you how to check your pulse, and I will show you how to check your blood pressure so that you can do that on a daily basis. Here is a pamphlet that explains to you all the things I've just mentioned. And do you have any questions about the information I'm giving you?
No, not right now.
Okay, well, if you happen to go home and you have a question, you can call us here at the hospital. You can call Dr. LOL, and we'll be able to help you. Now, let me show you how to check your blood pressure and your pulse, okay?
Okay, mija. Thank you for your help.
You're welcome.
Good
morning, everybody. I would like to thank you for coming to our in-service session for today. Behind me, you will see a video that we will be playing for you about the different drugs that we have available. So if you can please take down some notes so that you can take them back to your facility, that would be great. So, Tim, can you please put on the video? Okay, we're ready. Okay, so enjoy your show. Thank you.
Hi, colleagues. Thanks for watching and tuning in to MedWatch. My name is Celia Anaya, and today I'm here to speak to you about the beta blocker propranolol. In healthcare, we all know that hypertension exists, and we know that it's the main cause of heart attack and strokes. I will explain some information that you can use within your facility to speak to your colleagues and your patients, and so you can learn more about this medication. Please stay tuned.
Welcome back. As nurses, we should monitor the patient's blood pressure beginning treatment and periodically thereafter. The pulse should be checked every 4 hours. Note the rate, rhythm, and quality. Also be sure to check the apical and radial pulse before administration. Notify any significant changes that includes a pulse less than 50 beats per minute or the systolic blood pressure less than 90. Propranolol comes in suspended release capsules, injections, and oral solutions. Some side effects include depression, hallucinations and dizziness, bizarre dreams, and disorientation. The following are life-threatening like bradycardia, CHF, pulmonary edema, and dysrhythmias. Some precautions that we need to look out for are for pregnant women or breastfeeding women, children, and diabetics. For assessment, you as a nurse should check for baselines in renal and liver functions tests before therapy begins and periodically thereafter. Assess for edema in feet and legs daily and monitor the patient's eye and nose and weight as well. Check for jugular vein distension, crackles bilaterally, and dyspnea. Also monitor the skin turgor, dryness of mucous membranes for hydration status, especially in geriatrics. Lastly, assess for headache, lightheadedness, and a decrease in blood pressure. That may indicate a decrease in dose. When administering medication, you as the nurse should not break or crush this medication. You should also allow within a 2-week period to subside the medication. Patients should also be encouraged to stop smoking and drinking alcohol. The patient should also be on a limited sodium diet and should also comply with a weight control program and exercise. Ultimately, hypertension can't be prevented, but it can be controlled. This concludes our Medical Watch program for this week. Please access our website at medicalwatch.org for more information. Thanks for watching.